Well, good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Friday, October 7th, 2022. And our top story today, mental illness. Women often get worse care than men. Elizabeth, it's great to see you. Thanks so much for joining us on the program this morning.
Thank you for having me.
And we're going to talk about mental health, but in particular, women's mental health. And I want to take a step back, and I want to kind of I'm a very linear type of thinker, but I think for the benefit of the audience, let's just talk about mental health in general. And we just came through the pandemic, and every article I read, including the one that you were featured in from the Seattle Times, mental health is a big struggle for so many Americans. I want to get your thoughts on this. How was the pandemic shaped and impacted our mental health?
Absolutely. Well, I think we all collectively as a society have been at an increased level of stress, and that on top of all of the other stress that everyone experiences living their daily lives, whether it's like my six-month-old downstairs or job stress or financial stress, just that elevated stress from the pandemic and the unknown of and uncertainty of what was to come, and scared for your loved ones and your own health, really just has a negative impact on mental health as a whole.
Yeah, and I mean, it's just, no matter who you talk to, we're all concerned for our families with the inflation, economic strife, as you said, and on top of that, coming out of the pandemic, concerns about jobs. A lot of us feel that. Let's talk about how women are doing. People like my mom, my wife, my cousins. How are women doing with their mental health? Are they more challenged or less challenged than their male counterparts?
Yeah, women just historically and to today have an increased role in caregiving and things around the home. And so there's research to show that more women left the workplace as a result of the pandemic, and more women were having to adjust their work schedules in order to take care of their kids because of childcare or school being closed. And so that ultimately has a big impact on mental health because of the, again, the increased stress that these women might be experiencing.
Yeah, and I've often said, I think outside of the first responders during the pandemic, the parents had a really rough go of it because they were managing job, home life, and shepherding, their kids through some type of virtual education. Moms really took the brunt of that, or women took a big brunt of that.
And there's also research to suggest that women value their relationships with other people more highly than men on average. Again, these are all, research and based on averages, but because of the isolation from the pandemic and your lack of ability to socialize and sort of maintain those relationships, that will also have a more of an impact on women than men.
Let's talk about mental care because I think that as a result of the pandemic, there's more awareness. I think people like you and other researchers and other advocacy groups, are talking about these issues, whether it's for school-age students, for adults like myself, for yourself. Let's talk about care. Is there an equitable distribution of mental health care, whether it's a psychologist, psychiatrist, or some other facility to help walk women through these challenges that you're articulating?
There is not. So the organization that I work for, the Treatment Advocacy Center, we work to improve access to treatment for people with severe mental illness. So schizophrenia, severe bipolar disorder, major depression with psychotic features, really the most severe of psychiatric disorders. And the mental health care system really is not set up to help these individuals with them that in most need, and especially women. There's research to show, and research that we conducted, that found found that women have less access to treatment than men. And that includes inpatient hospitalizations. So women or all people with severe mental illness may need inpatient hospitalization at some point over the course of their lives. Severe mental illness is just like any other chronic illness that symptoms wax and wane over time. And when symptoms are at their peak, then people might need inpatient care, and it's important to have access to that care when they need it. And because for a variety of different factors, the availability of inpatient beds have declined in the past 70 or so years in the United States, and that is especially true for women.
And I was going to ask you the why. Why is there that, I can, if you paint with a broad brush, men, we're stubborn, we don't always want to seek treatment. It's a little, even though I have spoken with a psychologist, I think it's very cathartic. I think it's very helpful. But women, why isn't there this access that there should be? I know you mentioned the lack of beds and hospitalization, but overall, why just the lack of access? Is it a lack of funds or a lack of facility?
Both. There's lack of mental health care funding that therefore then translates to lack of capacity within the system. There's a phenomenon sort of known as cherry picking, where facilities and providers will sort of cherry pick patients that they want to be treating and leaving those most in need and the most sick and sometimes perhaps more difficult to treat patients behind. And especially for women, I think that women's in terms of severe mental illness, their symptoms present differently than in men, and most of the diagnostic criteria and sort of typical case scenarios are based on symptomology in men. And so women presenting with the same illness might present differently and might not be as understood by the providers. There's this sort of structural and institutional biases against women that they're experiencing when they're showing up in need of care, and the sort of provider bias of, assuming that maybe women are more emotional, or maybe it's just depression, or and rather than taking their symptoms seriously.
Yeah, I just laugh when you do the air quotes. I mean, I felt depression. It feels painful, and I can only imagine. I know it's certainly something that should be dismissed. Elizabeth, I need to take a very quick break. When we come back, we'll talk more about mental health treatment for women, what needs to be done. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Are you over 50? Would you like to get up to 33% more income in retirement? Then call now for this free book, Annuity Do's and Don'ts for Baby Boomers. This free book reveals little-known secrets about annuity strategies that will help you make the right choices before buying an annuity. Call right now for your free book, and as a bonus, we'll also throw in a free annuity rate report, both absolutely free for calling Annuity General today.
Call 800-504-8194.
Elizabeth, thanks so much for staying with us this morning. Really appreciate you having you remain on the second segment of our program.
Thank you for having me.
Well, obviously, this is a very important issue. And it affects so many people. And the thing, as you're saying, you can't just walk down the street. I can look down and see if someone has like the chicken pox, right? I can see pock marks, but I really can't tell if someone is suffering from mental illness on the street. And obviously, this is an issue for so many people, men and women, but today we're focusing on women. What can we do to improve mental health, I guess, awareness, but also treatment for individuals so that they can get the treatment they need, because we all go through tough times.
And this is timely as it is Mental Illness Awareness Week this week. So I think education and awareness around mental illness, and specifically severe mental illness, is very important because severe mental illness doesn't discriminate, but most people don't necessarily know about it until it impacts them or their loved ones or their family. And so an individual walking down the street that sees someone that's experiencing homelessness and potentially acting erratically, they might not understand why that person is acting that way and may not treat them with compassion and empathy and understand that it's a brain illness that they're suffering from. It's not, they're not acting that way out of malice or, and so it's really, that's education and awareness is really important from a public standpoint. So we all understand what severe mental illness is, how it impacts individuals, and what we can do.
Yeah, awareness, it's just understanding and treating people as they're individuals and knowing that our own biases, our own experiences shouldn't color, for lack of a better term, someone else.
Exactly.
Do we need more practitioners? I think we did a show about a week or two ago with the American College Medical Association. I think I'm getting that right. And there's a shortage of certain practitioners. Is there a shortage of mental health practitioners, people that have the expertise to deal with serious mental illness?
There is a shortage of mental health clinicians at every level, whether it's psychiatrists all the way down to case managers. In fact, workforce shortages within the mental health care system is one of the largest drivers for the lack of access to mental health care right now, especially after the pandemic. Workforce issues are impacting, multiple places throughout healthcare, childcare, but especially mental health care. It's within psychiatrists. There's a projected shortage due to retirements of current, the current workforce, and then less people going into these professions.
Yeah, I think we want to encourage people to pursue these types of vocations. And I think I got the name right. I think it's the American Association of Medical Colleges. But be that as may, there is a shortage. Let's talk, kind of end the program on research. And I know that you were the lead researcher in this particular report around serious disparities. What do we know? What do we need to know? I mean, there's been so much in the news about the human brain recently, whether it relates to concussions. What do we know? What do we need to know in terms of studying mental illness? Because I feel like we've been studying it for a long time and we've made some progress. We've got drugs, we've got ways of treating, but what do we need to know for the next round of research?
Absolutely, yes. We know that severe mental illness, like schizophrenia or severe bipolar disorder, is a brain illness. And however, we still don't really know the causes and the etiologies of where these illnesses come from. There's some thoughts around genetics, and there certainly is a factor. Genetics do play a factor. However, the role of genetics, as we learn more, is probably less so. There's the immune system, inflammation, viral infections. There's a lot of different theories out there. And importantly, the treatments, the medications to treat these mental illnesses were the last antipsychotic medication was developed more than 30 years ago. And there really isn't a lot of research being done right now to improve these medications. These currently available medications have extreme side effects. About 30% of people with severe mental illness are treatment resistant, meaning the currently available medications do not work for them. And so there's a real need for more innovation and research funding into this area.
Yeah, we're certainly seeing a lot more cases of mental illness. This pandemic has done a whopper in so many ways with people. Elizabeth, we're going to have to leave it there. Thanks so much for joining us, and we look forward to having you back on the program again very soon.
Thank you.
That wraps up this episode of BRN AM. Have a topic of interest, somebody you think we should talk to? Drop us a line, and don't forget, for all the latest curated news and lifestyle, wellness, finance, tech, entertainment, so much more, all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content? Well, visit our website and, of course, our streaming partners. We're back again tomorrow for BRN Weekly. I'll be taking a look back at some of our best segments for the week. A quick note, I want to say to my dear friend Kenji Cheetah, I miss you greatly, my friend. Think about you every day. Until tomorrow, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes. Now is your opportunity to co-create content around any topic on the First Lifestyle and Wellness Network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.